Change in 24 hours as we are learning and adapting in our COVID world. The travel bubble with Sydney is now on pause and under continual review. What do we know about the New South Wales cases? Joining us now is the Director General of Health and potential in the nicest New Zealander file as well, Dr. Ashley Bloomfield. Ashley, g'day, good morning.
Good morning to you.
Nice to have you on the program. So how concerned are we about this breakout in Sydney?
Well, I think the key feature of it, and this is one of the main pieces of information behind our call to, on balance, pause things just for the moment, is we're still not quite sure of the link between these two new cases. They are a husband and wife, and it seems that the man got infected first, but we're not sure of what the link is between him and this case in managed isolation who returned from the USA. And I guess it's that until we know about a little more about that missing link, and as well there are some positive sort of sewage results in one part of Sydney, we'd be keen to find out a bit more about. That's key information. And we have also seen the New South Wales authorities put in place some restrictions around gathering size, use of masks and so on. So they, it seems, are anticipating or at least trying to head off any further community transmission.
What's the likelihood that the missing link has come to New Zealand? I mean, it would be a very small chance, wouldn't it?
Yeah. Oh, look, I'd say an extremely small chance. And in fact, I think there's only a very small chance that anyone who's travelled to New Zealand from Sydney in the last few days, it's 5,000 or 6,000 people, that any one of them were also at one of these places of interest at the time of interest. But we're not taking any chances there. We're going to contact them all just to make sure they know what those places of interest are and they know what to do if they happen to be there.
OK, so you will get around the 5,000 or 6,000 people who have arrived in New Zealand in the past, whatever, few days. How hard will that be? How difficult is it getting hold of these people?
Well, in the first instance, we email them, but one of the things that was put in place when the quarantine-free travel started was this sort of pre-departure provision of information. People have to provide, we've got a new database, it's called No Mai. It's looked after by Customs, and people have to provide good contact information before they travel here. So we'll upload that information into our contact tracing centre, we'll get emails out to them, and then we'll follow up. And anyone who may have been at a place of interest will be given instructions to call Healthline.
When you said at the start of this interview, on balance, we decided to go with the this lockdown approach. Was it close the other way as well? Were you close to say, look, just carry on with the bubble?
Well, for the first 24 hours, we didn't pause the flights while we gathered information. And the key thing here is we're in really regular contact with the authorities in Australia, in particular our New South Wales colleagues. We're getting great information from them. We participate in the teleconferences with all the states every day. So we didn't for the first 24 hours. It was just yesterday, these bits of outstanding information. We'd just like another couple of days of testing of people in the community who have been in these places of interest. And so, yeah, it was a line call. But, of course, what's served us well to date over the last, more than a year now, is where we have these line calls, just taking that precautionary approach has put us in a good position.
Two quick questions. If we're taking a really precautionary approach, will we test 5,000 or 6,000 people who came back into New Zealand, the people who came back on the flights? Will we test them or not?
That won't be necessary, and we're again following the lead of New South Wales, who've got really good contact tracing systems in place. So we will be just identifying those who have been at the places of interest, asking them to isolate and be tested. Other Kiwis who have returned here, or Aussies who are travelling here, and welcome to them, there's no need for them to isolate and be tested.
This missing link, it's confusing, isn't it? Who is the missing link? Where is this missing link? What was going on?
Well, I wish we knew, and I think the New South Wales colleagues would wish they knew as well. But we've seen this here in New Zealand. You know, this virus is unpredictable, and very often, even if we get around to these cases and don't have any further spread, we never quite pin down exactly how the transmission occurred. I know they'll be working hard on that, but the key thing at this point for them, and indeed for us, is just to head off any further spread.
This person was in a quarantine hotel, correct?
Yeah, so this is someone who returned to Australia and was in a quarantine hotel. They returned on the 26th of April, tested positive on the 27th, and then this community case and then subsequently his wife have got a genomic link across there. So in a way, that's good. It shows that it's a case from the border. It's not a case that's just arisen out of nowhere in the community. And it's also quite recent, which is good. So it's highly unlikely there's more than one missing link between the two. And I know that they'll be testing staff and others around that managed isolation facility and just seeing if they can find the link between the two.
Ashley, just more on a personal front from you. You know, we have this travel bubble, it gets paused, it gets unpaused, paused and unpaused. Have you actually personally booked a trip to Australia yet? Do you have any intention of going there in the near future?
I haven't booked a trip, actually, and no intentions. I've got plenty to do on this side of the Tasman. I have to say, maybe like a lot of Kiwis, I found my passport had expired during last year, so I did get that renewed, but no, nothing booked yet, either Australia or the Cooks. But, you know, we have seen a lot of travel across the Tasman, even in this 3.5 weeks since the quarantine-free travel came in. Over 50,000 people every couple of weeks coming this way. So it's great to see people I know that will love being able to, link up with family and friends again, and that's what this is about.
Were you concerned that 2 flights did take off last night? So 2 flights, one into Wellington, one into Auckland from Sydney. So they took off before midnight, of course. So they didn't breach anything there, but they took off after the announcement. I wonder, were you concerned about that? Just have the ban straight away.
Yeah, no, not concerned about that. Actually, yesterday there were, I think, a total of 13 flights out of Sydney to various places in New Zealand. The key thing is, right from the start, as soon as we found out about this case, we put in place this, in a sense, ban on anyone travelling to New Zealand who had been in one of those places of interest, and they have to follow under the law in New South Wales. They have to isolate and be tested, and there are a number of measures in place, both in Australia, then in-flight announcements, and then when they land at this end, to identify anyone who may have been at one of those places. Now, of course, there may be people here who subsequently we identify further places of interest. So if that does happen, and with people who are already here have been at those places, they will then need to isolate and be tested. So we'll keep the communication coming about any additional places.
Brilliant to have you on. Actually, we're putting you on the nicest New Zealander list. It's a finals list, so you haven't been yet. The final result is not yet named, but you're on the list. Okay. If you do win this, are you allowed to accept the prize as a senior public servant? It'll be a mug, about $3.99 mug. Will you be able to accept it?
Oh, well, first of all, it's great, very kind of you to put me on the list of potential candidates there. I would, I think, be able to accept that, but I'd have to declare it on my gift register.
Yeah, no, I think you should do that. That means you would have declared the other one we gave you as well, hopefully.
You're not the keeper of the list. Well, I'm the Trevor Mallard of this list, all right? You got to get through me first.
Oh, boy.
I'm saying lovely bloke, but I'm going to put him on the most inoffensive people's list.
Oh.
I mean, there's nothing to dislike about him, but does he hit the likability at the other end of the scale?
Yes.
Yeah. Yes, you do, Ashley.
Ashley, you've got our vote, mate. Don't worry. You're on. Don't worry. We'll roll Trevor here, don't you worry. Director General of Health, Dr. Ashley
Thanks very much.
Bloomfield. Appreciate it. Nice to have you on the program.